Today we're going to talk about the autism spectrum disorder. And I chose this because I just think it's super interesting. There's always more you can learn. So we'll talk about the description of what it is, the characteristics, how it's diagnosed and assessed, educational considerations, support services and resources, and then references. So we're going to start off with Temple Grandin's quote of, "There needs to be a lot more emphasis on what the child can do instead of what the child cannot do." I think that's so important because a child can do so much, and if we focus on what they can do instead of what they can't do, we are able to learn so much from them. So the description and the definition. Autism spectrum disorder is a neurological and developmental disorder, and it affects many parts of a person. It definitely affects how people interact with others, communicate, learn, and behave. It is a developmental disorder because symptoms generally appear in the first 2 years of life. That's not saying that you can't be diagnosed later in life, because many people do. It's just saying that usually symptoms are there when you are a young child. And it's super important to understand that it is not linear. So someone can't be less autistic and then on one side and then be very autistic on the other. It's more like a circle where they can have a lot of social differences and then have very little sensory sensitivities, something like that. So, like in the photo, you can see how a child or a person may be having more emotional regulations than interests or something like that. And the terms high functioning and low functioning and Asperger's are super harmful and it's outdated. So, as people, we need to learn to not classify them in high functioning and low functioning and using the term Asperger's. So now we'll talk about the characteristics, and there's a lot of characteristics of autism. And like I said, it's a spectrum disorder, which means that there's a wide variety of types of severity and symptoms that people may experience. And the characteristics are super lengthy and are in different categories due to the fact that everyone is unique. So, some characteristics are delayed language skills, delayed movement skills, delayed cognitive or learning skills, avoids eye contact, hard time making connections with others, lack of social communication and interaction skills, hyperactivity, impulsive, and other inattentive behavior. Epilepsy or seizures can also be found in people that have autism, and usually eating and sleeping habits are very unusual, and unusual moods or emotion reactions, and anxiety, stress, or excessive worry, and lack of fear or more fear than expected. So, as you can see, there's many different characteristics, and every person is different. So, some people will have delayed language skills. So, instead of talking at the normal age of when doctors say that children should be talking, they talk a lot later, or they don't start walking or crawling when they should be. But just because a doctor says a child should be crawling at, I don't know, like 6 months or whatever it is, that doesn't necessarily mean that your child is going to have autism. And like I said, it's very important that we all know that children with autism spectrum disorder are not the same. And some may show many characteristics, while others show slim to none. And that's how people can become undiagnosed. So, how it's diagnosed and assessed. So, it's diagnosis is super, like, kind of tedious. It's not easy. There's not like a blood test or x-rays that can diagnose someone with autism spectrum disorder. Doctors depend a lot on the parent's observation along with the child's developmental history and behavior. It can be detected at 18 months of age or younger, and there is a screening process that doctors usually recommend parents have their children screened at 18 and 24-month checkup. Usually doctors will just say, "Hey, we're screening your child at the 18th 18 and 24-month checkup. And most parents are fine with that. If you don't want that, then you can tell them not to, and they won't screen your child. So developmental monitoring, that is always an active and ongoing um, assessment and monitoring. Um, Observing how the child grows, and they are seeing if the child meets typical milestones or skills, which means if they are playing, learning, speaking, behaving, and moving at the recommended time that the doctors believe is what they should be. So if they're playing with others or they're able to speak and move at the time that a baby should be or a child should be, then that's just something that they pay attention to. And the developmental screening, so this is the second step of screening and is based on research, and it compares your child to others of their age. And it usually asks about language, movements, thinking skills, behaviors, and emotions. And can be done by doctors, nurses, professionals in healthcare, community, or in a school setting. And it indicates if a child is on the right developmental path. So this is more of like a questionnaire that these professionals complete to see if the child is at the developmental level that they should be. And then the developmental diagnosis is if area of concern formal evaluation is done by a professional. This is more in-depth observation and questions. So the parents have a lot of questions they have to fill out. The doctors have a lot of questions they have to fill out. Sometimes teachers have a lot of questions. And then there's a lot more observation. So the child might even go to like a counseling facility and they observe them. There's just a lot more different questions. And next is the educational considerations. And so accommodations, there's quite a few, as we've probably all seen, making sure that there's a clear, ordered routines. That's super important. And definitely if like the routine is going to be changed or is anticipated to change, just giving them a warning. So let's say there's supposed to be a fire drill and it ends up raining and the fire drill is going to be canceled, and you know that, you should allow the student time to be aware that the fire drill is going to be changed, because it's also important not to just spring that there's going to be a fire drill on them. They like to prepare ahead of time. And practice communication skills, that's always important, telling them how to communicate their feelings and what they're thinking. And you can do the same way, like, I feel hurt when you did this. And then the child can then respond back with, I feel sad because this happened. And just working on that is super important. And noise canceling headphones in loud areas. So a lot of the times that will be in like the lunchroom, the gym, other places like that where there's a lot of loud, chaotic things going on. Um, that can just cause more silence and they don't get overstimulated as much. And having a quiet area for breaks is also super important. So that can just be a quiet corner in the special ed room, or even like a quiet corner in the classroom where the whole class knows, like, this child will go there if they're feeling overwhelmed. And then many visuals like schedules, so visuals of how the day's going to go. So like morning, put your backpack away, then lunch, or then breakfast, and then we're going to go to gym, and then we're going to do reading, and like different things like that, so the child can see what the day is going to look like. And then having emotion cards can be super important, because sometimes children can't really say how they are feeling, but they can find a photo or a picture of someone feeling that way, and they're able to point out how they feel. And having photos all around the room of like what's in drawers, like papers, pencils, basketballs, different things like that, that's super important as well. And then assistive technology. So the AAC is promoting independence, expanding communication, and increasing social interaction. So that's just kind of like a website or like a program that can allow students to work on their independence and communicate through that. And they're able to read and increase all their social interactions on that. So if they have a problem with speaking, they can push a picture, and then the picture will say how they're feeling, and that's how they can communicate. So, also, here's like another thing about visuals. So, they will help promote transitions, provide directions. Breaks and tasks are easier to understand the steps, provide structure, assist in organizing, support appropriate behavior, and development choice making skills. So, those are just some reasons of why visuals can be super important. And then differentiated instruction. So you can do student grouping, which will establish multiple or similar ability groupings and then divide groups according to similar interests. And that can just be helpful because the students are then able to connect with those people more. And having clearly defined roles for each student in the group. So if one person's the note taker and the artist and the reporter, then everyone has a group, and that's just helpful for people with ASD, just so they are aware what's really going on. Instructional activities. So, like it said, support verbal information with visuals. So not only speaking it, but also having the visuals and level and type of support provided to the student. So that includes tasks that the student can participate in or complete independently. Or they can do in a small group, or it's more of like a full group activity. And then task exemptions. So sometimes students with ASD, they may need more time to complete an activity or have it split up into big different sections. And so that just allows them to be able to get it done on their own time, but also still having the timeline that they need to complete things in. And encouraging them to use technology like computers or other things like that, that's super helpful as well. Materials and resources. Sometimes having students um, just be able to use what they are interested in can become very important in their learning. And then assessment activities. So instead of giving them tests, just allow them to fill in the blank, do drawings, questions of multiple choice answers. Instead of doing like the normal tests that other students might take, being able to change the test so it better fits them is super important. So, support services and resources. So I live in the Fox Valley, so I just think the Fox Valley Autism Treatment Center is super important. It provides high quality applied behavior analysis treatment to achieve goals for their clients and families. So due to the fact that I do live in the Fox Valley, that would be a place that I could go and get more information on autism spectrum disorder as a teacher, or if someday I have a child with autism, that would be a place that you could go. And then I think the Sibling Support Project is super interesting. It's a project that works with brothers and sisters of those with disabilities. So not even just autism spectrum disorder. They work with all students or all children, brothers and sisters that have a sibling with some type of disorder. So that's super cool. They do like projects, and it's not just in one location. It's all over. So you can start your own sibling support project in your area. And then the TWACCH Autism Program provides information on clinical services, trainings, and research, and so much more. So that's just super important. You can get more training on how to work with students with autism and all the research behind it. And then Exceptional Lives helps find services and walks families through the process of applying for disability benefits for children that have disabilities. So, this is also something that doesn't need to be done only in your state. So, these people are in a different state, but you can reach out to them and they will put you in contact with people in your state and they will help you go through the process of applying for the benefits. If your child does have a disability, it doesn't just have to be autism, it can really be any disability. And then Organization for Autism Research helps teachers learn about autism and how to better support students with ASD. And that's another really interesting one that I will definitely look into when I become a teacher because I know that many of my students will probably have autism, and it's just very important to learn how to better educate them. And then these are just my references that I used. A lot of them were more of like organizations, and the CDC was really beneficial. So if you want to learn more about that, um, they had a lot of interesting information.